Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the thyroid gland and parathyroid gland. So what is thyroid gland and parathyroid glands? They are endocrine glands. Endocrine glands. Okay, very much important for our survival. The thyroid gland, if we go to the thyroid gland, this gland is very essential to maintain BMR, or basal metabolic rate, growth of the body, and growth of the nervous system, If you go to the parathyroid gland, that is also associated with calcium metabolism, along with the thyroid gland. So thyroid gland is essential for growth of the body, growth of the nervous system, plus calcium metabolism. Okay, we'll go there. Thyroid gland and parathyroid gland. First of all, I will discuss about the thyroid gland. So thyroid glands are located in the neck on the anterior aspect, on the anterolateral aspect of the trachea, as well as lower part of the thyroid cartilage. So we have two lobes of the thyroid gland and one isthmus. Okay, so lobes and isthmus, lobe, another lobe, and connecting to lobe is the isthmus. So the vertebral level of the thyroid gland is from C5 to T1, from C5 vertebra to T1 vertebra. Okay, the vertebral level of the thyroid is from C5, cervical vertebra 5, to thoracic vertebra 1. Okay, so this is related to the lower part of the thyroid cartilage plus the trachea, and this is the isthmus. This is related to the second to fourth tracheal rings. Okay, we got the thyroid gland location. Okay, thyroid gland is covered by a capsule derived from the pretracheal fascia. Okay, so thyroid gland is covered by pretracheal fascia. Okay, we got that. And thyroid gland has two lobes. Sometimes we may get one pyramidal lobe from the isthmus. So we may get one pyramidal lobe from the isthmus. That pyramidal lobe may be connected to the hyoid bone like this. pyramidal lobe. Here, this is the pyramidal lobe from the isthmus. It may be connected to the hyoid bone. Okay, and we have some muscular tissue in that connection. We call it levator glanduli thyroid. So some muscular tissue connecting the pyramidal lobe tip to the hyoid bone. Suppose this is the hyoid bone. Okay, so you got the hyoid bone, and this is called levator glanduli thyroid. Okay, levator glanduli thyroid. Okay, so that connects the pyramidal lobe. It is not always present, but if it is present, you may get the levator glanduli thyroid, a muscular fibromuscular band. Okay, we got the two lobes, left lobe, right lobe, connecting by an isthmus. From the isthmus, we may get a pyramidal lobe that may be connected to the hyoid bone by levator glanduli thyroid. Okay, this is an endocrine gland, so it is very vascular. This is an endocrine gland, so endocrine, that means it has no ducts. So the secretion of this gland reaches the blood directly. So in the substance of the gland, we have a lot of fenestrated capillaries. Okay, under the capsule we have also venous plexus. Okay, we have venous plexus under the capsule of the thyroid gland. Okay, I will go to the blood supply of the thyroid gland. Blood supply of the thyroid gland, that is very important. Blood supply. Okay. Arterial supply. What artery supplies the thyroid gland? The thyroid gland is supplied by the superior thyroid artery and inferior thyroid artery. Sometimes also by another artery, we call it ima artery or arteria thyroidea ima. So we have always superior thyroid artery, we have inferior thyroid artery, we have inferior thyroid artery, and not constant, we may get arteria thyroidea ima, arteria thyroidea ima, or just ima artery, ima artery. Okay. So that may or may not be present. Okay, but these two are constant. Superior thyroid artery supplies the upper part of the thyroid gland. Superior thyroid artery is the branch of the external carotid artery. This is the first branch of the external carotid artery. Okay, we got that. Inferior thyroid artery supplies the lower part of the thyroid gland, and it is a branch of the first part of it is a branch of the first part of subclavian artery. We got that. Arteria thyroidea, it supplies the isthmus, the junction between the left lobe and right lobe of the thyroid gland. So this is the isthmus area. Isthmus. It is getting, this is the isthmus. Isthmus, and it is getting blood supply from arteria thyroidea. That is usually a branch of the brachiocephalic trunk or brachiocephalic artery. Okay, brachiocephalic trunk. But it may be a branch of the arch of the aorta, may be a branch of the subclavian artery. We got the arterial supply. Now we go to the venous drainage of the thyroid gland. Venous drainage of the thyroid gland. Okay. Venous drainage. Okay. Venous drainage by the superior thyroid vein, middle thyroid vein, and inferior thyroid vein. Okay. Superior thyroid vein, inferior thyroid vein, and we'll have also, we may add the middle thyroid vein here, middle thyroid vein, and the inferior thyroid vein. Okay, venous drainage of the thyroid gland by the superior thyroid vein, middle thyroid vein. They opens into the internal jugular vein. Internal jugular vein. Okay, internal jugular vein. We got that. How about inferior thyroid vein? Inferior thyroid vein opens into the brachiocephalic vein. Brachiocephalic vein. So we got the blood supply. We have the artery, again, superior thyroid artery, branch of the external carotid artery, inferior thyroid artery, branch of the thyrocervical trunk, that is a branch of the first part of the subclavian artery. Artery, usually branch of the brachiocephalic trunk. Okay. Venous drainage, superior thyroid vein, middle thyroid vein opens into the internal jugular vein. Inferior thyroid vein opens into the brachiocephalic vein. We got the venous drainage. Okay. Now we have to go through the importance. We must go through the lymphatic drainage of the thyroid gland. Lymphatic drainage. If we go to the lymphatic drainage, lymphatic drainage. Just to remember where is my thyroid gland is. It is located over the trachea. So our lymphatics will drain into the pretracheal, paratracheal lymph node. Pretracheal and pretracheal, paratracheal lymph nodes. Okay, lymph nodes. Okay. Also, from the thyroid gland, we get lymphatic drainage to the deep cervical lymph nodes. Okay, we can say superior and inferior deep cervical lymph node, or upper and lower deep cervical lymph nodes. Okay. Some of the lymphatics may go to the brachiocephalic lymph node, even it may go to the thoracic duct. Brachiocephalic lymph nodes, cephalic lymph nodes, and even may go to the thoracic duct, because thoracic duct, especially on the left side, is very close to the thyroid gland. Okay, thoracic duct directly. Some of the lymphatic may go there. So we got pretracheal, paratracheal lymph node, and deep cervical lymph nodes mostly. But we have to know that it may go to the brachiocephalic lymph node, it may go to the thoracic duct directly. Okay, we got the lymphatic drainage. Now we'll go to the nerve supply of the thyroid gland. Nerve supply. Okay, nerve supply. Nerve supply. Okay, the thyroid gland get innervation from the middle cervical sympathetic ganglion. Cervical sympathetic ganglion mostly, but it also get nerve supply from the superior and inferior cervical sympathetic ganglion. Okay, superior cervical sympathetic ganglion. So mostly from the middle cervical sympathetic ganglion, but the thyroid gland also get innervation from the superior and inferior cervical sympathetic ganglion. Okay, what is the role of sympathetic nerve supply to the thyroid? They are vasoconstricted. Okay, the thyroid gland secretion is controlled by the thyroid stimulating hormone, that is controlled by thyrotropin releasing factor from the hypothalamus. The role of the sympathetic nerve supply is vasoconstrictor. Okay, we got that. Now we go to some of the relationship of the thyroid gland. Okay, so this is a section at the level of the isthmus. So this is a lobe of a thyroid gland. This part is the isthmus connecting the two lobes. This is the structure trachea. Trachea, there is the windpipe containing hyaline cartilage, C-shaped manner. Posteriorly we will get the trachealis muscle, and this structure is the esophagus. Okay, we got the esophagus. In between the trachea and esophagus, we'll get the recurrent laryngeal nerve. Recurrent laryngeal nerve. Okay, the recurrent laryngeal nerve are very important, especially it may be damaged in case of thyroidectomy operation. The left recurrent laryngeal nerve is a branch of left vagus nerve. It turns around the arch of the aorta. The right recurrent laryngeal nerve is a branch of the right vagus nerve. It turns around the right subclavian artery. Okay, so this structure may be damaged recurrent laryngeal nerve during thyroidectomy. Okay, if it is damaged, it's because they innervate the intrinsic muscles of the larynx. All the intrinsic muscles of the larynx are innervated by the recurrent laryngeal nerve, except cricothyroid. So all the intrinsic muscles of the larynx are innervated by recurrent laryngeal nerve. If it is damaged, then patient will develop hoarseness of voice. Hoarseness of voice in the post-operative days. Okay, or any cancer in the thyroid gland involve the recurrent laryngeal nerve, that may also lead to damage to the recurrent laryngeal nerve, leading to hoarseness of voice. Okay, so we got that. So this is recurrent laryngeal nerve. Another one. What is this? This is the carotid sheath. Carotid sheath. What does it contain? The carotid sheath is present posterior to the thyroid lobes here in the neck. It contains the internal carotid artery, internal jugular vein, and the vagus nerve. Again, this is the internal carotid artery here. Okay, this is the internal carotid. Here we can call as, because it is the lower level at the level of isthmus, so we can call here, this is the common carotid artery that will be divided into internal and external carotid artery. This is the common carotid artery. This is the internal jugular vein. This is the vagus nerve. This is the common carotid artery. This is the internal jugular vein. This is the vagus nerve. This is at the level of the isthmus. So we'll get the common carotid artery. Okay, as a content of the carotid sheath. At the upper level, we'll get internal carotid artery. Okay, we got that. Then the thyroid gland is also related to the muscles. What muscle? This is the muscle. This is the thyroid. This is the sternothyroid here. This is the sternothyroid. Actually, this is the sternothyroid. Sternothyroid muscle. How about this muscle? This is the omohyoid. Omohyoid muscle. Omohyoid muscle. How about this big muscle? Let's make it a little bigger here. What is this big muscle or this big muscle? This is the SCM or sternocleidomastoid muscle. Okay. So these are in relationship to the thyroid gland. Okay. Laterally these muscles. Medially two tube. One is trachea, another one is esophagus. And just in between trachea and esophagus, we have the recurrent laryngeal nerve. What is this? On the posterior border of the lobe of the thyroid gland, these are the parathyroid gland. We have 4 parathyroid glands. Okay, so they are located around the posterior border of the thyroid lobes. Okay, we got the relationships of the thyroid gland. Then we have to know what is thyroidectomy. Thyroidectomy is a surgery that is commonly practiced to take out the thyroid gland. Surgical removal of thyroid gland is the thyroidectomy. Okay, that is surgical removal of the thyroid gland, Okay. We discussed that there may be chance of damage to the recurrent laryngeal nerve during surgery. Okay. Sometimes surgeon may do partial thyroidectomy. Partial thyroidectomy. Idea is that they keep the posterior part of the thyroid gland plus the parathyroid glands. so that a person may not suffer from hypothyroidism or myxedema after the surgery, or they may not suffer from the parathyroid hormone deficiency or calcium metabolism disturbance. Okay, we got that. The thyroidectomy, we'll get a term very frequently that is called goiter. What is goiter? Goiter means enlargement of thyroid gland. Enlargement of thyroid gland. Okay, it may be due to hyperthyroidism, especially in case of Graves' disease. It may be due to hypothyroidism, due to iodine deficiency. We have enlarged thyroid gland. Okay, we got that. The thyroidectomy, partial thyroidectomy, will go through a little bit histology. If we have a section of this thyroid gland, we will get multiple follicles. Okay, follicles. We get multiple follicles. Okay, we may make only 3. Okay, so follicle are lined by follicular cells. Follicular cells. Okay. Okay, we get the follicles. These are the nucleuses. Where is my parafollicular cell? Parafollicular cells are present here. Here is the parafollicular cells. We get parafollicular cells here. Okay. So what is released from the follicular cell and what is released from the parafollicular cell? Follicular cells they are associated with synthesis of T4, T3, T2, T1, that is monoiodotyrosine, diiodotyrosine, triiodothyronine, thyroxine. This is colloid. Okay. This is protein-rich fluid, colloid. Okay. This is colloid. That is protein-rich fluid. Okay. What is the purpose of parafollicular cell? This is the parafollicular cell. Parafollicular cell. What is released from parafollicular cell? They releases the thyrocalcitonin, or also called calcitonin. Thyrocalcitonin. What is the purpose of thyrocalcitonin? Thyrocalcitonin actually keep the calcium in the bone. Okay, they keep the calcium in the bone. Okay, we got that. The parafollicular cell. What is the purpose of follicular cell? To produce T4, thyroxine, triiodothyronine. They are associated with basal metabolic rate, BMR, plus growth of the nervous system, growth of the body as a whole. Okay, so thyroid gland is not only for growth of the body and the nervous system, also it is associated with calcium metabolism by release of thyrocalcitonin by the parafollicular cells. This is a colloid. The height of the follicular cell vary depending on the function of the thyroid gland. If it is very much active cell, then if it is very much active in hyperthyroidism, the cells are columnar cell. Okay, so these are columnar cells in hyperthyroidism. In case of hypothyroidism, cells are more or less squamous or low cuboidal. Okay, this is the hypothyroidism. This is hyperthyroidism. Hyperthyroidism. cell are columnar cell, follicular cells. This is colloid, certainly. This is colloid. This is colloid, big size colloid plus more or less squamous cell, maybe low cuboidal cell. This is in case of hypothyroid condition. Okay, in normal person it is low cuboidal. We call it euthyroid. Euthyroid. Okay, so we got little histology there. Okay, development of the thyroid gland. Yes, what is the development of thyroid gland? Okay, development of thyroid gland. It is developing from the floor of the pharynx. Floor of the pharynx. At the base of the tongue. So tongue from the foramen cecum. Foramen cecum that is present between the anterior 2/3 of the tongue and posterior 1/3 of the tongue. Then from the tongue it goes down in front of the hyoid bone, in front of the thyroid cartilage, in front of the cricoid cartilage. Then it is localized around the trachea, upper part of the trachea, okay, part of the thyroid cartilage. Okay. Sometimes that journey may not be comfortable. Sometimes the thyroid gland may not descend. We'll get lingual thyroid. Lingual thyroid, if you look at the patient's posterior 1/3 of the tongue, we may get swelling. Okay, it may be harmless, it may be with normal thyroid function, or it may be associated with hypothyroidism, around 33% cases. Okay, the thyroglossal duct, the route through which the thyroid gland descend down, it may not disappear. We may get thyroglossal duct cyst. Thyroglossal duct cyst, or we may get fistula. Okay, that is possibility. Okay, we got the development of the thyroid gland. We'll go to the parathyroid gland. Okay, where is my parathyroid gland? Parathyroid gland are present posterior to the thyroid gland, along the posterior border of the thyroid gland, and we have 4 parathyroid glands. So if you look at the posterior aspect of the this is, if you think this is posterior aspect of the thyroid gland, then we'll get 4 parathyroid glands. Okay, this is a parathyroid gland. We have 4. But their location is very much inconstant. They may be the substance of the thyroid gland, maybe just under the capsule, maybe not in the thyroid gland, maybe in the superior mediastinum, maybe in the anterior mediastinum, behind the meningeal sterni. There is a possibility. And these are small gland, around 6 millimeter, 4 millimeter, 2 millimeter. So this is not it is in comparison to thyroid is smaller. It may be around 5 centimeter. Okay, maybe 3 centimeter, maybe around 2 centimeter. Actually the thyroid gland maybe 6 centimeter, 5 to 6 centimeter, around 4 centimeter into 2 centimeter. Okay, and parathyroid gland is in millimeter, so it is certainly smaller than that of the thyroid gland. Parathyroid gland, developmentally, our superior parathyroid gland, they are derived from the 4th pharyngeal pouch. Inferior parathyroid gland, they are derived from the 3rd pharyngeal pouch. Okay, pouch, pharyngeal pouch, also called branchial pouch, same thing. Okay, so what is the purpose of parathyroid gland? They release a hormone, we call it parathyroid hormone. Parathyroid hormone, also called parathormone. What is the function of parathormone or parathyroid hormone? They release the calcium from the bone. They release the calcium from the bone to the blood. From the bone to the blood. So just opposite to that of the function of the thyrocalcitonin, that is released from the parafollicular cell that keep the calcium in the bone. This hormone from the parathyroid, they release the calcium from the bone to the blood. Okay, so that's all about the thyroid gland, parathyroid gland, gross anatomy, part of the histology, and little bit embryology. Okay, if you like my video, please subscribe my channel, please hit the button, and please feel free to pass any comment. Share the information with your friends. Have a nice day. Bye now. Thank you.